Hello, and welcome to the Hospice Education Podcast. We are exploring topics that will help you grow as professionals. Today, we're talking about passion fatigue. Joining me today is Suzie Scullion. Suzie, would you like to start by introducing yourself and your background, please?
Yeah, sure. Hi, Mandy. So I'm Suzie. I started out as a community nurse. I went newly qualified straight into the community. Yeah. But that's my passion, actually, in nursing. I did that for several years, and then when I had children, I then went on and did agency nursing, which was great because I had a good bit of experience in lots of different areas.
Yeah.
And then I came back to the community. I worked for Single Point at St Helena, and I've been at St Helena ever since.
Wow.
So that's me, yeah.
So a lot of flexibility when you've got children, obviously with the agency working, but like you say, a real opportunity to gain a lot of knowledge in a wide area. And then you've come back to palliative and end-of-life care here at St Helena.
Yeah, that was always my bag when I was a community nurse. Actually, I really enjoyed palliative and end-of-life care. So I knew it was something that I wanted to do in the long term. So yeah, here I am.
Excellent. So obviously today we're looking at compassion fatigue. What is compassion fatigue?
Okay, so we'll start with the basics. Compassion fatigue is sometimes described as the cost of caring.
Okay.
It's an emotional and physical exhaustion that can arise from supporting people who are experiencing suffering, trauma, or loss. So in palliative care, we walk beside people in some of the most profound and vulnerable moments of their lives. We hold grief, uncertainty, fear, and love, not just for the patients, but often for their families too. So over time, that deep emotional engagement takes its toll. You may hear compassion fatigue referred to as secondary traumatic stress.
Wow.
This means even though that trauma isn't happening to you, the repeated exposure to others' suffering impacts your emotional world in real and powerful ways. So how does it show up? As a practitioner, you can feel emotionally drained. You can lose empathy. You can feel numb. You may find that you're more irritable or you're getting sudden frustrations. Withdrawing from colleagues or patients. You can have difficulty concentrating, trouble sleeping, unwinding after shifts, and feeling done before the day has even started.
Wow.
But the important part of this is compassion fatigue is not a sign of weakness or incompetence. It's a normal human response to prolonged emotional intensity. So when I was practicing, I absolutely had compassion fatigue. For me, I felt I was constantly anxious.
Yeah.
Not just at work, I was at home too. I didn't sleep. I couldn't unwind after shifts. I was losing empathy and I was feeling very numb. And my poor husband, I was very irritable. I didn't realise that I had compassion fatigue.
I was going to ask you that, whether you actually put a label to it or just thought it's part of the job.
And to be honest with you, I was absolutely, I thought I can't be a nurse anymore. I thought this is something that because I'd seen it in other nurses, particularly when I was training. And I thought, if I ever get like that, I'm not going to be a nurse. And so now it's the realization that actually I had this compassion fatigue. Unlike other healthcare settings, palliative care asks us to form a deep relational connections with other people to support. We don't treat the symptoms, we hold a space for other people's distress, emotional anxiety. There could be family conflict, any unresolved trauma that they're experiencing. and you're getting these profound emotions, and you're facing morality.
Yeah.
Obviously, in palliative care, the bonds we can build with these people and patients and families is beautiful, but it's also really heavy. You're encountering repeated losses. You've got unpredictable emotional landscape. You've got families in crisis. You've got the pressure to get it right.
Yeah.
And you've got limited resources and increased workloads.
Yeah.
So when you combine all of that, and you've got natural empathy that draws people, so it draws us into this job.
Yeah.
The
And
result
draws people to you.
Yeah, absolutely. And it's the result is where this compassion fatigue can grow, and but quietly and beneath the surface, so you don't really realize it's happening.
So it almost can sneak up on you.
Absolutely, sneaks up on you.
Okay.
And so you've got the compassion fatigue, but there's also a burnout.
I did wonder if there was some comparison, or whether they're different things.
I always thought,
just a label.
Yeah. Well, when I was having all this, when I was in practice, I thought, I was saying, I think I'm burnt out. I think it's a burnout. But compassion fatigue is the emotional exhaustion that stems specifically from exposure to other people's suffering. It's a personal, it's emotional. Burnout is more driven by systemic factors.
Okay.
So workload, staffing levels, which we all get, any organisational pressures, bureaucracy, lack of control, and a chronic stress.
Yeah.
And it's usually slow in building up. It's cumulative.
Yeah. So actually, they're quite different when you unpick them.
Yeah.
But when you sometimes are verbalising what you're feeling, it could be quite easy to
say
call it burnout. But actually, it's more emotional.
Because actually, you do feel burnt out.
Yeah.
Emotionally burnt out.
Yeah.
But it's just slightly different. This is more organisational.
Yeah.
I'd say the burnout.
No, that makes perfect sense.
And then you've got a moral distress. So this is a distress that we feel when we know the right thing to do for the patient, but we can't do it because of barriers and sort of systemic, ethical, or practical barriers. So in palliative care, actually, all these three things, so your moral distress, your burnout, and your compassion fatigue, they can often overlap.
Yeah, I can see some areas where that would definitely be
100%
not easy to identify which element that might fall into.
Exactly. Yeah. And so it's all mushed in together almost. And so you may experience moral distress from staffing shortages, which fuels burnout and then leaves them more vulnerable to compassion fatigue. So actually naming these experiences help us respond to them.
Yeah, definitely.
Basically, yeah.
It makes a bit of clarity. It pulls that, as you called it, that mess, that mash of everything.
Yeah.
You can start actually pulling it apart, and then hopefully you can start to look for strategies or information that might help you with those things.
Exactly that.
Yeah.
Or ask for support.
Yeah.
Yeah, 100%. So, like I say, I've come across it quite a bit. It's more common than people realise. I think, like you say, verbalising it. If people talk about it, people talk to each other how they're feeling, 9 times out of 10,
that must help.
It will. Someone else will be feeling that way too.
And sort of what I've heard from what you're saying as well is that palliative care is a high risk environment for those conditions because of everything you're dealing with, and that unique relationship with the family and their loved ones of the patient is a different relationship to perhaps in other health and social care settings.
Absolutely. So I think really some things that I remember from practice is people going home, not being able to switch off, going to sleep at night, thinking about things that have happened in practice. You're running on empty. How am I ever going to refill this tank, essentially? I think what we need to remember is the signs that someone is failing. I'm saying that in inverted commas. They're signs that they're deeply invested, they're deeply compassionate, and they're deeply human.
Yeah.
I think you were telling me a nice analogy about the suitcase.
Yeah.
In palliative care, we have all these losses, and they all go into our suitcase, and slowly, they build up, and you're then not able to shut that suitcase.
Yeah.
So it sneaks up on you. It's a kind of a slow realization. Actually, something's not quite right here.
And I assume there can also be triggers in the fact that, you know, when you've been doing your job for a long time, there will be memories that come in from another patient or something where you've had a similar experience.
Mm-hmm.
That must be quite difficult to deal with as well, because I love the way that you say you're human and therefore you're going to have these. I think sometimes I've looked at some of the colleagues I work with and I think they forget that, and
Mm-hmm.
they forget that they are human and therefore these emotions are real and need to be explored sometimes.
Absolutely. And it's not wrong.
No.
You know, you kind of think, oh, well, I'm the professional nurse, I've got to, you know, be at the top of my game all the time. But actually, yeah, like we discussed, it's being human. So, I mean,
they're like early warning signs, do you think?
So that's exactly what I was going to say. So there are early warning signs. That compassion fatigue might be creeping in. So some of them, you, like I said before, you might be feeling numb to a situation, to something that actually used to be emotional and move you. You could avoid going to see patients, or have any family interactions. You could be struggling to switch off after work, becoming impatient over small things, like I said, my poor husband, and feeling guilty. You're not able to give as much.
Yeah.
So as well as that side of things, our bodies can tell us a lot as well.
Yes.
You might be constantly tired, get headaches, muscle tension, stomach issues, dodgy belly, and sleep, disrupted sleep. So I think the key is noticing the patterns early, not once you're already overwhelmed.
Do you think as well, Suzie, that as we work with our colleagues, we also need to be mindful of looking for those signs and asking those questions?
Absolutely.
Because sometimes I know in my past someone has said something and I've thought, actually, maybe I am not as tolerant as I should be. And it's just, you know, it can be difficult, but I think it's important as colleagues that we're also aware of those signs and looking for them.
Definitely. I think peer support is hugely important. I think looking out for your colleagues, friends, just a little check-in to say, how you doing? I've noticed this. Are you okay?
No, that's good advice.
Yeah. So the good news with compassion fatigue is you can address it. There are practical ways to, like I was saying, to support ourselves and each other. So I've got maybe a few little things. Do you want me to tell you about them?
Yeah, I would.
So we could have, first one, micro breaks, taking tiny pauses.
All right. I was wondering what they were.
Yeah. So 60 seconds just to breathe, stretch, or step outside. It might seem insignificant, but actually they're able to reset the nervous system. Having healthy boundaries, so compassion does not require self-sacrifice.
Wow, yeah.
It's okay to be emotionally present without absorbing every detail. It's okay to say, I need a moment, or can someone else support this conversation? And then, as we were saying, the big one, peer support. Talking with colleagues who truly understand is one of the strongest buffers. And it can be an informal chat, part of reflection in groups, supervision, any debriefings that you may have. Or just a cup of tea with your pal, or someone that understands it.
Do you think in your profession, I'm just thinking this through, do individuals see it as a weakness rather than a strength for asking for help? So in some professions, it's inbred, the culture is inbred that you ask for help, you will do that. And in other professions, it's not so easy. And I think sometimes my thoughts are, in your profession, you're perceived to be the experts and be the specialists in that area.
Yeah.
So what are your thoughts on that?
Absolutely. I think that you feel that you're not doing your job properly. That is quite a big element, is having that compassion.
Yeah.
And if that is numbing down, say, or you're being more affected by what you're dealing with.
Yeah.
I think that's I think in nursing, if you say so, occasionally, sometimes depending on who you work for, it can be seen as a weakness.
So I suppose there's a lot of self-development and awareness to actually say, actually, I want to do the best job I can.
Yeah.
And to do that, I need to flag up that I'm struggling a little bit here.
100%.
Can I have some help?
Yes.
Yeah, okay.
Absolutely.
That makes sense.
100%. And I think things like, which in nursing, it's since day dot, is reflective practice.
Yeah.
So often, because every 3 years you've got to write 5 reflective practices. So I know, and it's like, oh, really? Here we go again. But actually, reflection is not indulgent; it's clinical safety. So it's really important. And then there's having self-compassion. Give yourself a break.
I think we're not very good at that,
No,
are we, as individuals
it's huge.
often?
Yeah. You cannot pour from an empty cup.
Ooh,
I know, I'm
like
full
that
of them
one.
today. But it's so true. Self-compassion is not selfish, it's essential, particularly if you're caring for others. So what is self-compassion? It's acknowledging your limits. It's being kind to yourself. It's letting go of being perfect, because nobody is.
No.
That's not life. And it's recognizing that it's human to struggle. Little things you can do, and I know you do this one. So ritual, you have a ritual at the end of the day.
I do.
Yeah, absolutely. So these small actions can signal to your mind and body that the workday is over. So removing your lanyard, washing your hands with intention, stepping outside and taking a deep breath.
Closing the door quietly.
Yeah, I know. It was and then these rituals sort of help you separate your work from home.
Yeah.
Or they can help do that. I think over time, doing it over time, I don't think once it's not going to do anything, but doing it over time, I think is really going to help.
I think it's really important what people can do. And I think what you've said there is it doesn't happen overnight. You have to be quite disciplined sometimes to have those boundaries kept in place, and also not beat yourself up if you don't do it all the time, but you're getting better. I think, you know, the full session that you do, the longer course, actually is really beneficial to look at how you as an individual, because what we could suggest today might not work for someone else. You know, like my end of the day ritual is because I was a workaholic, and I know that I need to do that to go home and not think about what I've got to do. But it's really interesting that finding what works for you is the tricky bit, isn't it?
Yeah, absolutely. But it will happen.
Yeah.
If you're focused on that, you'll be able to do that. I think as well, asking for support from your organisation,
Yeah.
from your line managers, the counselling services, clinical supervision. You can go to your Oki Health team, and then there will be some staff wellbeing resources.
I mean, here we're so lucky.
We're so
with,
lucky.
The stuff that Tim and Jenny do, etc., that we've got that in the background.
Yeah.
From this session then, and thank you, Suzie, for this information, what are 3 things should our listeners take away from this session going forward? What could they be?
3 things to take away. So it's recognition, recognizing that something's not quite right, and exploring that.
Yep.
I think it's understanding. So it's recognizing that. It's understanding if it's compassion fatigue, or if it's more to do with organizational issues, and therefore it's kind of maybe more of a burnout happening. And then understanding what you need to do, where you need to go to get that help, who you need to talk to, whether it just be your colleague, your mate who sits next to you, or you want to take it a wee bit further, you just need a bit more support and you go to your line manager and find out there.
That's 3 really useful tips. Thank you today, Suzie, for your time.
No problem.
I know how busy you are, so I'm sure our listeners will really appreciate it.
Lovely.
Thank you.
Thank you.